what we have created is something different, and hence I'll just give it to over to Mr. Shishir. When he goes through it, you'll understand what exactly we are talking.
Hi, good evening, everyone. I would just like to once confirm with you all if I'm audible enough to everyone.
Yes, you are. Shishir, but give us a second. Give us a second. I just want to check with my friend Chirag. Chirag, you have started to record or just wait?
Yes, I have. I have. We can start off. Yeah.
All right.
Excellent.
So give me a
Okay.
sec. Yeah, go ahead, please. Yeah. Go ahead, Shishir.
Okay. So I'd like to just briefly introduce what we are doing and what our vision is, not just for us, but for all of India, actually. So we started off with my father, who's Dr. Deepak Ved. He's a very renowned physician, and he's been picked up in different associations, and he even headed the associations for medical consultants in Bombay. He found out that during the course of his time in the medical field that our medical landscape needed a lot of changes and a lot of upgradations from the inside. So he thought of this idea of trying to create a system with which all the medical players, like the doctors, the ambulances, the hospitals, the test centers, the pharmaceutical companies, the insurance companies, one way to unify all of them in a way that they can talk harmoniously with each other. So that was the goal of my father, his lifelong vision that one day maybe all of the players in the healthcare could be able to communicate in the background with each other and make a very efficient healthcare ecosystem in our country. So with this vision, my father started off with creating this platform in which is something as simple as patients coming forward and reaching out to doctors for consultations, online consultations for getting prescriptions, getting their test examinations done. Those things would leave to the patients yet connecting with the test centers to get their results from them. These would also lead to the hospitals generating reports, sending them directly to pharmacies or online on their system, which can be verified and approved, to also having the government view into all of this in a privacy focused way so they can monitor the spread of diseases or to pick up on trends in different areas of the country so they can analyze if, hey, this industry is polluting too much that's leading to these diseases to these residents, or hey, before the monsoons, there are a lot of cases of dengue in this specific neighborhoods in this city. So we might need to go and produce the fumigation syringe as a fumigation foam in that area to prevent the spread of diseases in this area. Or they can also keep a track on how many pregnancies are we expecting in this community, in this town, and to help with population dynamics. So all of these aspects for creating a form of an information flow of the whole entire medical system is what was my father's idea. So we started off very small in the last few years where we created a system where consultations for patients and doctors could take place on a platform, and also hospitals can add in data of their existing doctors on panel and all the incoming patients in the outpatient department and the inpatient department, and their information could be stored. And to them, prescriptions can be provided online, and these prescriptions can be verified by the pharmacies that can be dispensing the medicines appropriately to the patients. So as for now, where are we? We've done some pilot tests in our own hospital and some partnering hospitals in different cities, even small cities like Guwahati in the northeast, and some small cities in the south of India, and some major cities as well across India. So we've created at different scales, different kinds of tests and pilot programs. And through our platform, currently we've gathered at least, I guess, around 2.5 crore worth of revenue in the last year. So we're not technically a fully functioning platform in the sense that it's out for everyone to use, but it's a pilot test. And we have about, I'll let Dr. Deepak Ved give in the exact metrics of how many people we have onboarded. But in our current phase at the moment, we are in the service providers onboarding phase. So we're being onboarding hospitals, we're onboarding doctors, we're onboarding diagnostic centers, blood banks, and all of the service providers in our platform. And very soon we're transitioning into a phase where we're going to go into customer acquisition. So all the common citizens in the country who would be potential patients would be advertised about our products and they can soon join us into it. We would also like to add a back end with the Ayushman Bharat, with the government scheme, so that we can also pull in the government, the public healthcare, and also attach that to our system. So it would make everything harmonious and let all the information flow easily and let the government have an oversight into it as well. We also want to add the insurance providers into our system so that people with certain insurance can easily find hospitals near them that are covered under them, and also patients who do not have any insurance, but accidents happens to everyone. So in those kind of cases, they can apply for something known as post-trauma insurance, where it's like a medical loan, but by insurance companies themselves, that they can pay over time. So no one is denied healthcare because they cannot afford it at that point in time. So our goal is to make healthcare easy, accessible to everyone, and every citizen can have our application in their mobile, which will store all their health data, including all the previous tests that they have received, including all the prescriptions that they've had, including all the birth certificates or COVID vaccination certificates or any other vaccination certificates, be it tetanus or BCG or any kind of vaccinations or treatments they've received from anyone. We also want to make things easy where, for example, we go to a small hospital that is not very tech savvy, but the hospital advise you to go get an x-ray from a different center that provides only diagnostic services. But those centers will probably give you a report after 3 or 4 days. So instead of the patient having to run to different places or wait for some things, all the centers would be, all the small centers would be given our software free of cost to use, and hence all the patients would be receiving this information digitally at the moment that the process, at the moment the tests have been processed. So everyone gets the information immediately, including the doctors who can sit back at their home early in the morning while they're reading the newspapers and also see all their patients' informations that have been updated in the last evening, let's say. So this would make everything very convenient and easy, and we can avoid many repetitive visits and all of the other hurdles that come in the way of this process as we have right now in our day. We also want to make it easier for hospitals to purchase equipments and pharmaceutical products by pooling together 14, 15, 20 different hospitals who want to buy, let's say, an X-ray machine. And once we know that all of these hospitals are interested in purchasing one equipment, we can contact the manufacturer of this system and a request for like a group discount or some kind of arrangement with them. And that way we can make everything easy for everyone, basically. We also want to make it easy for the taxation purposes for the doctors, so that we can generate all their bills that they have created in their annual year, and they can use that to pay the taxes very easily. We would also like to help them with their fire certification regulations and keeping up with all the standards of the medical sphere that is required for them to follow to be recertified for the next year. So with all the different aspects of the medical field, we would like to help and make it easy. And we start off right now in our stage with just having a module between the doctors and patients and hospitals and service providers for diagnostic and blood banks at this phase of our journey. So I'd like to invite my Dr. Bates to give us some.
Before we go to Dr. Bates, Shishir, so
Yes.
Shishir, thanks for this. But I want to bring out the 4, 5 and summarize for the whole team as well. 4, 5 points that I understood, or maybe 6 points. Just you are going to use big data or the state of the data in the country at that point in time from a healthcare standpoint to predict certain things. Like, you said in the beginning, right? If there is dengue somewhere, then you could fumigate that area, or some other place, pregnant woman, or the health crisis in some area, then you can take some predictive actions, proactive actions in those areas. That's one thing that was clearly coming out. Then you're talking about the health in the insurance companies, connection to them, which could reduce underwriting losses and all that, and help uh, the things between the whatever that insurance and the quickness of approvals and all that, which can eliminate a lot of hassles that a patient has to go through in the end, and also later on or in between. Those areas can be addressed by the thing that you are talking about. And also with the various network of hospitals that your father already is would be connected to. There are a lot of things from the healthcare standpoint as a service that you can deliver. That is the third major area that I could feel. And finally, you talked about how you can provide everything. I mean, from blood and all that, and the hospitals can cooperate in a collaborative fashion. A lot of the services that the citizens of this country need. These are the 4, 5 areas that I thought were what you basically told us. And if I missed out something, please do add in 1 or 2 lines so that our panel is clear. Because there's no presentation, we have a written thing, so we need to register with us. Otherwise, we'll get lost a little bit. So, Shishir, just 1 or 2 more points to this if I missed out. Otherwise, this is what we are looking at here.
Absolutely. So these were a few examples of what our system does encompass, but our goal is to touch almost every aspect of the
Every
healthcare system, including things such as if you need an emergency, you can call an ambulance very easily. That will take you to the appropriate hospital if it's already in your system. So it touches every single aspect of the healthcare system. And the following were the examples that I just gave, so that people could understand from different sectors how it will affect and how it will make things better. From the government to the private insurance to the common patient to a simple hospital. And our main goal, as we know, like the healthcare field in India, we have major hospitals that have their own systems in place already. Like, for example, the Dhirubhai Ambani Hospital would have its own electronic healthcare system. They'll have their patient records and reports. But if you think about a common small nursing home, they do not have access to this technology. They do not pay for expensive softwares, and they do not know how to do all of this. So we come in here where we provide this free of cost to all small hospitals, big hospitals, test centers, anyone and everyone in the medical field. We provide it free of cost to them as a service provider to use. And I didn't get to this point, but basically the way we would make revenue is for any transactions taking place on our platform, we do take a small platform fee. So from something as simple as calling an ambulance or paying your bills,
like a software,
that's where we would generate.
Software as a service to the hospital.
Exactly.
That become a SaaS product for all the small hospitals which cannot afford or cannot build on their own systems. They can come on your platform and get the services from there. So
Exactly. And
basically you're building a tech company, right, which is in the healthcare space, right? That's what you're trying to do here.
That's correct. That's correct. It's a tech company in the healthcare space. And another important thing would be, even for people who do not have access to technology, even say simple as a smartphone, that they're not very savvy to use it, we also have a background system that sends things as SMSs to patients saying that, hey, this doctor has put it over here, click here to see it. So they can just click on the button and they can open on a web browser. So we want to create this system very easily for even the common citizen who might not have much technology knowledge, but they will also be connected to this smart world that we're going into.
Perfect. Over to you, Deepak sir.
Dr. Baid, are we connected?
Yeah, I think he was. I think he momentarily lost the connection because it's.
Yeah, I believe there must be a technological.
Yeah,
yes, there we go.
Yeah, there he is.
Yeah, just a minute. Am I audible now?
Yes, you are.
Sorry, there was a little connection error. Okay. What Shishir said, thank you. And thanks, Sanjeev. I'll just add in a nutshell what we are doing is we have created a health platform. It's a health ecosystem. In short, whatever we are doing physically, we have digitalized it. In short, like presently everything is scattered. Everything is like in today's emergency. If you want an ambulance in the middle of the night or you want medicine in the middle of the night, it's a Herculean task today. You may have to just go down and search for it yourself, which chemist is open or something like that. So what we have done is we have created a health ecosystem platform where all the players of health are in one platform, interacting with each other. For example, a patient, a doctor, a pharmacy, diagnostic, ambulance, blood bank, hospital, vendors. When all of them are in the same platform, the interaction is huge. The data assimilation, the way they talk to each other is good, and it's fast in real time. So not only have we created a platform, we have created it 24/7. That means in real time, and it's like continuity. That's what we have done. So this is the only thing which is existing today in the market, which actually connects in real time everybody. So when this type of interaction occurs, like we are already existing in 7 states, 7 cities to be precise, where almost 70% of the service providers we have onboarded. So a doctor need not only be listed, but he's been given a software where he has also, you can say, online consultation, a video consultation, a clinic visit, a home visit, accounts, as Sishi rightly said, everything is there in the same. We even have an inter-app chat to talk to each other. And because of which, we have almost all the big brands joining us. So today we have more than 58,000 service providers joining us, as already registered in the app, in which we have all the big brands, the Thyrocare, the Metropolis, the SRL, Lupin, Healthians, Redcliffs, and in the pharmacy side, Wellness Forever, Noble Chemist, Royal Chemist, all of them have joined us. And more than almost 16,000 diagnostic centers, almost 11,000 pharmacies, nine and a half to 10,000 doctors, 1,600 hospitals, 1,400 ambulances, 200 blood banks have already joined us. So our main intention is to make the health sphere totally digital. So the interaction between all the players, like I can just give an example, like uh, we are like the Swiggy of health and the Amazon of health. That's what I always compare ourselves with. And that is how we revolutionize healthcare and bring everyone closer to each other. Thank you.
Perfect. Questions. What do you see is the competition today? Or I would imagine nobody is doing this end-to-end thing. But what do you think is the closest competitor
Uh,
today that you see?
So I think Dr. Bates' connection has got stuck again, so I might answer this question. At the moment, in different verticals of ours, we have different kinds of competition.
Right.
So let's say, for example, the patient and doctor consultation model, we might have a competitor like Practo, which would be very good in that one specific field. Then in another field, which is medical deliveries, we might have 1mg. So as you see that in the whole field, we have certain competitions in certain sectors, but that would only encompass around 30 to 40% of what we are actually doing. For things like the government panel to access where and what kind of ailments are present across the country, there's no competition. For hospitals to buy equipment at a cheaper price, there is no competition. For quick access to ambulances, like we do not have an Uber for ambulance in India, for example, there would be no competition in that kind. So in many fields, we do not have a competition, let's say, at the moment, because we see that this is a very young field in our country at this point. And in fact, not just in our country, in many other countries, I've lived in different countries across this time period of mine. I have not seen something where we have these kind of systems where the whole healthcare system is unified under one umbrella, which I think is a great opportunity because our country is progressing immensely and we have this drive towards technology. So we could set an example throughout the whole world with something like this.
I would just say one point. Am I audible?
Yeah.
Yes.
Yeah.
Yeah. Uh, See, since we have created a market space, we are more of collaborators than competitors.
Mm-hmm.
Like, for example, Pharmacy will be selling medicine, but they may have a retail store. Thyrocare, which is a part of Pharmacy, is in diagnostic, is a part of our app. So many of the apps who are existing in the market can join our app. Like, let's put it, Ayushman Bharat is a government vertical where people will be joining. Similarly, we become like a private version of Ayushman Bharat. We are
Mm-hmm.
creating a market space. We don't believe, I mean, definitely there is going to be certain areas of competition, especially in the doctor sphere, where we may be listing doctors and giving appointments to doctors, and Practo may also do the same thing. But what we have is an ecosystem which no one has. Second thing, in various spheres like pharmacy, diagnosis, we give a marketplace where people can join in. Ambulances, people can join in. So we don't compete with ambulance providers. We in fact give them a provision. We collaborate with them where they can join our market space and even reach out to customers.
Absolutely. I mean, that's what is the Amazon model or the Swiggy model, right? You integrate the demand and supply in all the areas of healthcare, and then you can deliver the services, and people get convenience, and they're ready to pay for that convenience. So that's the whole point of this. All right, gentlemen, please ask the questions. And Vijay, you raised your hand. Sorry, I'm completely. Please ask the question.
Yeah, actually, I want to know about the. You said that medical emergency services you are providing, right? So you know the dial 4567.
In Maharashtra, 4567 is not the thing which we have in Maharashtra at least. In Maharashtra, if we have to go reach out to an ambulance, it is 108.
No, no.
And
Actually, a dial 4567 is one of emergency services provider, and they are into the only for the emergency services. Like if anyone have some emergency like medical, uh, like police protections requirement, like um, any kind of fire safety, any kind of services, emergency service, they are required. So. They have some one software which can be used for the one sensor means they push the button and then mobile camera, both of camera, front and rear, both camera can get the video and with the audio and with the live location. send to the command center, and also with their family members, they have the information that some emergency is there, right? So it can be used for medical emergency as well. They are using that services.
Yeah.
And also doctor doorstep in Ahmedabad and Baroda, they have some emergency services like that, and they are collaborated with the dial 4567, and
Oh.
also I am a part of the company. And so you know that dial 4567, that's I'm asking about that.
Yeah. Me, I have not frankly heard about it because in Maharashtra we don't have it as such. I mean, maybe the penetration in Maharashtra is not strong here. What we have in our app is SOS. Like SOS means it is given to doctors. Even they feel threatened by the patient, then SOS button goes to the nearby doctors. It reaches out. It gives them a location of a doctor and the type of emergencies. And as far as patients are concerned, it can go to a contact. So if they are having some medical emergency, it can go to a contact. That's what we will be adding now, the SOS concept. The second thing which we have is, God forbid, if someone has an accident, they can immediately see which hospital caters to accident. So that a person who's having an accident doesn't land up in a gynec hospital or some other surgical or ortho hospital, but definitely reaches out to a hospital which has an intensive care or operation theater, which can cater to an accident case. So these type of things we have in our app.
And at the same time, we can queue for an ambulance to come and pick
Yes.
you up with just a quick push of a button.
So we have that command center as well. If you want to collaborate with us, and if you need a API or for the set up your app, so we can
Collaborate. That is all. That is a wonderful
Absolutely,
thing.
yeah.
Yeah.
We are always happy to connect with more people and make everyone grow together. We are not the type of system that we would like to compete with others or pull anyone else down. We want everyone to grow. That's why we are like a marketplace system.
Right. You know the Zycom company?
Zycom I've heard of.
Yeah. So Pramod Rao is with me, and Pramod Rao is the director of the Zycom company, who is the first Indian who get that CCTV in India.
Wow.
So we are collaborated with him, and also we are part of the Zycom company, and IL 567 is a product of the Zycom.
I think we can complete a loop by collaboration. Like we can always have a collaboration in such a way that emergencies, when a patient reaches out to you all, and we can also provide the services to the patient without having to pay for it. So we can have a collaboration in such a way that we can provide the services to the patient without having to pay for it.
Yeah, Dr. Deepak.
Yeah, I believe there's a connection problem.
Shishi, you can complete, please. Yeah, go ahead.
Yes. So basically, we are ready to collaborate with anyone, and in case there's any person who's in this field who would like to collaborate with us, we're always open, and we'd like to help everyone up in the same field.
Perfect. I mean,
and connect everyone.
You can have more services as well as more areas in India to cover, which will be good for you. People will come to know about you, so on and so forth. All right, Arvind sir, you had raised your hand. Is the question ready, sir?
My question pertains to the competition, because you are not unique in the services which you provide. In fact, my own doctor had migrated to some firm called Eka Care, which I presume is disruptive. What you provide, he's migrated to another platform. That means something which is more disruptive. So, what is it that you have in your plans to, be more competitive, be more integrated? Because you see, as far as the Indian market is concerned, cost is something which is very, very important, and we are very conservative in our spending.
Absolutely.
And if you have been to a local chemist, you will find that most of the consultations are done by the local chemist. For the rank and file, and for the youngsters or the workers, for the people on the street, the local chemist is his consultant doctor. He is the one who prescribes, he is the one who disburses. In such a situation, where is it that you have come across, with a solution? which meets this standard, because you see that we have numbers. I was brought up in Africa, okay, where in the market, along with the vegetables outside, there are people carrying baskets of medicine.
Mhm.
Okay, so the unorganized sector, or the that sector is of course a different audience, and you are catering for a specific audience. You are specific to more urban centers, and like Dr. Deepak brought out, you're conceptually Maharashtra centric. I may be wrong, but that is the thought which I came across. You have tremendous potential, but how do you scale up against your competition, and how do you want to bring it down to the
Ground level.
those
Ground
not
level.
reached out?
Yeah.
Mhm.
I'll
That is the
mention.
concept.
So,
I'll
so
just
just to
mention
add
two
here,
things.
just to add here, Arvind, this company that you mentioned is based out of Bangalore. Am I right?
That's correct. That's correct.
Yeah. So that's the major question. How is it that you are going to scale around after Maharashtra and within also, and then what is the whole strategy?
No,
long term?
the issue is they were earlier with Docon.
Okay. Okay.
They were earlier with your platform.
Okay.
Achha, let me put it in a different way. I just understood two things were there. First point is our app is not Maharashtra centric because we already exist in Bombay, Delhi, Calcutta, Lucknow, Guwahati, Surat, and Nasik. So it's already existing there, and almost 70% of our healthcare providers have been onboarded from these cities. That is point number one. Second thing is, what is different in our app? See, the thing is, why are we different from any existing app is for only one reason: we are an ecosystem. Most of the apps which are for, let's give an example which is closer to our app, where everything is in one app, MFine or Medibedi. Even if you see MFine or Medibedi, you will find they may give doctors which are empaneled by them. It's not an open system where doctors can join in. Second thing is, apart from this, the pharmacy and the diagnostic, they act like a franchisee. There's not a single app existing presently which connects you directly with a pharmacy which is near your neighborhood pharmacy. Like when I said Swiggy of Health, what did I mean? A Swiggy connects a restaurant which is nearby to the customer. What we have done different is we have connecting each and every vertical of health which is near the customer with the customer. So what does it help? How does it help? It's a 24 by 7 module. Means it's a continuity day and night module which doesn't lag behind. Now, when you spoke of Docon and other apps, there are multiple apps existing in the market in bits and pieces. You may be having like Practo, which gives more of a listing of doctors. You may have a Docon, which gives a prescription module. You may have a Pharmacy 1mg where you can buy medicines. But when you have a nearby chemist, a Pharmacy 1mg may give a discount of 10, 15, 20%, or maybe 25% max. But when you have a nearby chemist, which includes a generic store, we found that a discount of up to 80% was given by a nearby store with a home delivery, which the customer was not aware of. They did not know where the location of a nearby pharmacy is, a generic pharmacy is. And the future is generic pharmacy. Even insurance is looking for generic pharmacy to cut down on their OPD module of cashless OPDs, to cut down on the cost of medicine even for IPD patients. So that is the future. And what we are looking for is not branded only. We are integrating the entire health in such a which is futuristic. So when we talk about competition, the reason we say that presently only certain areas of competition is there because the other areas have not been tapped. In future, they may be tapped by some verticals where nearby pharmacy diagnosing may be integrated. Like a Thyrocare may give 20% discount in my app, a Red Cliff gives 40% discount. A Wellness Forever gives 15%, a Noble Chemist gives 10%, where a generic store gives 80% discount. So the customer becomes king, and we now how Amazon is, we are providing a market space where everyone gives their own rate chart and their own this. So when we add the inventory, the customer again becomes king. He can choose a medicine. Medicine charge is the same across the country, but he can choose where he can get discount. and he can even choose a test which is most reasonable to him. So that is the way we are working, which is not existing now. So when we compare, these are things which are different. Like there will be bits and pieces of app. We have integrated everything in one app. That's the main what we have. Anything you want to add
As
on?
a real life,
Yeah.
yes, as a real life example, think about it. Like if you need to buy Crocin at 8 p.m. in the night in India, in any place where you're located, on Docsmart you can see exactly which are the chemists nearby, and you can see their price list along with it too, because they would be uploading it into our platform. The moment you see that, okay, there's chemist A which is 100 meters away selling it for 200 rupees a strip, but maybe around 250 meters away there's a chemist selling it at 180 a strip. So the choice becomes is put onto the patient that okay, maybe I can walk 50 meters more, but I can get it at 180. But these kind of facilities aren't provided in say 1mg, which has a flat rate at a flat time of delivery. So in that sense, we are giving more of the price sensitive audience a place to go and choose from, even more so.
True.
Yeah, I understand, Dr. Deepak, Dr. Shishir, but this whole world is all about, disruption. If I can pay 1 rupee less, if I can get 50 paisa worth more, it's all about that because our scales are very, very high. And especially if you look at healthcare, now though you're looking at only the class A cities and the larger markets, there's a wonderful market in the rural area. I'm sure what you're doing is interesting, and then you have grown up. I'm sure you can, measure up, and you can make a difference to a lot of people.
Yeah. I just add about the pharmacy thing.
Hmm.
Yes, it is unfortunate and fortunate that pharmacies are giving medicines directly. Abroad, pharmacists actually give dispense medicine abroad. In India,
We do have doctors. Like for example, I'm in Italy currently, and if I walk out to a pharmacy, and we have a national healthcare system out here. When I go up to them, at each pharmacy they have a doctor present in house at the back of the pharmacy, and they come up to you and they ask you, "So what is your problem?" They can even do basic diagnosis with like a stethoscope, and they have fever measurements, blood pressure, and they can figure out something basic, and they can prescribe you a medicine and it's added to your card of your national insurance.
so what I want to add is, in India the rules are different. A pharmacy cannot prescribe medicine directly. That is a rule. But the ground reality is, in urban areas, yes, it's a good thing to happen. The pharmacy are not supposed to, and they usually, but still, customers have faith on the pharmacy. They reach out and take medicine because they don't want to spend money on doctors, or like sometimes they feel doctors may just admit them or whatever the reason may be. In rural India, because of lack of doctors, pharmacies definitely are. In fact, they are God sent sometimes to the patient that at least something is being given to the patient. So there, the ground reality is totally different. But we have a scope of reaching out to them. But definitely, dispensing of medicine, as far as India is concerned, we cannot promote it in our app. But yes, we don't restrict anyone from doing what they want to do because ours is a marketplace. Everyone is free to do what they want as per the law of the land. We are not restricted. Over to you, Sanjeev.
Yeah, Sanjeev, yeah.
Yeah, I'm there, sir. I'm there. Anybody else has any questions? So I will connect you, Dr. Deepak Baid, with Vijay. That's what I got. And we are pursuing some things for you. So I was waiting for this show for a very long time. I had my own set of delays. Sorry about that. So with that, anybody has any last minute questions? Or else I will, yeah, go ahead.
Hi, I'd just like to add here that Dr. Bat's complete medical ecosystem is an excellent startup for interfacing among the patients and the doctors and all the other stakeholders. His model is collaborative. He brings people on board, and depending on their variety of technical interfaces as well as the business interfaces, he is moving in this process in a very gradual and deliberate manner. I think it's an excellent system, and he has a great potential everywhere in the rural sector also. and the cities also. Yes, it will require effort to roll out these systems in different areas, and he has a process for onboarding people also. Thank you so much.
Perfect summary, sir. Perfect summary. Very well said. All right. So with that, uh, we will end this call. We will be placing these recordings on our startup hub and also sending to our investors through email. And hopefully, you will hear more from people. All right, gentlemen, everyone, thanks for joining in. You guys have a great night ahead of you. Last, Digvijay, sir, you want to say something in the end? I'm happy to give the dice to you.
No, I just wish to thank everyone, everyone who joined, the founders of the startups and the invest panel, and all the people who have listened in. Most of the people listen in very silently. They don't ask questions. I just want to.
But I am so sorry. We missed out on certain very elementary things here. Dr. Beth, what is your ask? I'm so sorry I didn't ask. Nobody even asked from us. What is your ask, and how much are you willing to give your stake, and so that the valuation people who might be interested.
Presently, we are looking for 15 to 20 crores over a period of 15 months to spend, out of which approximately 75% of the amount will be spent on marketing, and almost 20% will be spent on capital operating expense, and remainder on the other miscellaneous expenses which will be there.
All right, 50 to 20 crores. And stake, do you have in mind, or you would want to negotiate on a deep dive?
No, it will be because we are bootstrapped till now, and I have spent almost 18 to 20 crores already in the project over the last many years. So yes, we can discuss and come to a conclusion what is the stake we'd like to go for.
Bharat sir, you want to get into a discussion with Dr. Baid in detail. That's what you're telling me, right, on the chat. Bharat Mittal sir has written, I think.
He said that he would like to connect with Dr. Baid separately.
Separately, all right.
Yeah.
So we will do that as well. So we have two engagements here. One with Dr. Bharat Mittal, Mr. Bharat Mittal for the understanding part of it, and Vijay for the collaborative part, where in fact you can increase the footprint of Dr. Baid's portal to many of the Gujarat area, wherever you're operating with the other vendors. Right?
Our app is existing in Gujarat, also in Surat, and the name of the app is Docsmart, which can be easily accessed. Docsmart. It is available on Android, iOS, and docsmart.in in the web.
I can connect you with CEO of Dr. Doorstep.
Okay, sir.
Yeah.
All right. Have a good night, gentlemen, all of you. And thanks for joining in. See you again.
Thank you, Sanjay.
Thank you for listening and have a great evening.